And
So
definitely not
then,
to mention thyroid, right? Because that's
well,
even,
yes, the thyroid,
oh,
they check only TSH.
yeah.
Yes. And well, I'll tell you something about my observation, and that's my theory. Um, chronic vitamin deficiency causes thyroid problems, especially hypothyroidism, especially autoimmune hypothyroidism. That's my theory because after observing patients for many years, I
Hmm.
found that that's what happens. They go, "Oh, I was low 5 years ago. I didn't pay attention." But patients come to me, they say, "I checked my thyroid. My thyroid is okay." But they give me all symptoms of hypothyroidism, everything: fatigue, sluggishness, constipation, you name it, weight gain, everything. But thyroid looking good. And then when you look at vitamin D is low. And there's actually a study that showed correlation between the level of vitamin D and the level of antibodies on the thyroid. The higher the level of
Mm-hmm.
antibodies, the lower the level, and vice versa. So one of my methods actually to it's number one. When you come to me, the first thing I look at vitamin D. That's the first thing because everything is built of vitamin D. Life came to this world through the sun. If we won't have sun for a week, for a month, for a year, life will disappear. Why? Because life comes from the sun because of the vitamin. One of the factors is vitamin D. Vitamin D is not just vitamin, it triggers, it activates. We're talking about activation. It activates and regulates 2,500 genes in our body.
Mm-hmm.
That's what vitamin D does. Besides just being building material for your hormones, building material for your bones, for your brain, for your nervous system, for your immune system, for your hormonal system, you name it. So vitamin D
Yep.
is number one. And majority of my patients come with deficient vitamin D. Like the lowest I had was 3. 3.
I think
One,
eight,
two,
eight,
3.
eight, and it was from a lady from Africa,
Imagine.
living in Africa. So it's genetic, yeah.
Exactly. So yes, it's crazy. So thyroid. Thyroid is one of those very interesting topics. And I think
Yes.
everybody, again, this is my theory, everybody gets at some point a little thyroid dysfunction, but body knows how to fix itself. And especially when we go through perimenopause, this is when thyroid starts showing up. Not necessarily on the blood test, but on the symptom wise. I started noticing a lot of my patients who in perimenopause and menopause really showing all the signs of hypothyroidism initially. And then after putting them on vitamins and good regimen, it levels itself and it goes away. So what are your thoughts on thyroid?
So I think inflammation has a lot to do with thyroid dysfunction. And I think the looking only at the thyroid, and let's first of all, let's clarify what is done in functional medicine as the panel for thyroid, but we're evaluating the thyroid function. It's not just TSH, maybe free T4 if they're lucky, but it's free T4, free T3, reverse T3, thyroid binding globulin, antibody panel. Everything is looked at so you can see exactly what's happening. Plus, again, some marker of inflammation. And the more inflammation there is in the body, the more problems with the thyroid function you can have. It's just that they don't manifest the same way depending on where this is happening. And people can have normal levels of TSH and maybe normal levels of free T4, but definitely they're not going to have normal levels of everything. And really, everybody should have 0 antibodies. It's not okay if you have, oh, it's within normal limits. It's like below whatever that is, 8 or something like that, or 5. No, you should have 0 antibodies. And once again, yes, absolutely. Once you fix the inflammation, you figure out why they have all this inflammation, and you address all the deficiencies. I like the micronutrient panel where you see deficiencies of everything, all the vitamins, all the minerals, amino acids, everything. Omega is so important. It's an anti-inflammatory, and fix the food plan. I don't like to call it diet, but food plan with nourishment and with the adequate vitamins based on these. and you eliminate the inflammatory foods in their diet, and you fix their gut, they definitely have a much better chance of fixing their thyroid problem as opposed to taking, thyroid medication. And now you have, maybe a thyroid that's leaking, because it's so inflamed. You put the medication in there, and then you expect to be able to measure it and to have an accurate measurement of the function of the thyroid based on a blood test. It will not be accurate because it's not possible.
True. It's true. Yes, I do the same thing. I do the full panel. I always look at the whole picture. And like I said, even if the whole picture is normal, if vitamin D is low, I still don't trust that normal panel.
Yeah.
Because
Yeah.
if my patient is giving me symptoms, there's something going on. And then I dig deeper. And this is where that cellular health and cellular investigation helps a lot. And targeting cellular health with the supplementation and activation is actually pretty good. It's important.